Assalamualaikum teman-teman. Kami dari kelompok 5 Prodi D3 Kebidanan Stikes Widya Dharma Husada Tangerang yang beranggotakan yang pertama ada Devina Apriani dengan NIM 1810303021 yang berperan sebagai istri pasien. Selanjutnya ada Eliza Rizkiani dengan NIM 1810303027 yang berperan sebagai asisten bidan. Next, ada Nagita Berlian Febianti dengan NIM 1810303011 yang berperan sebagai bidan. Dan yang terakhir, ada Tia Dea Afiska yang berperan sebagai suami pasien. And happy waking, guys! One morning at Clinic X, there was a tall married couple doing a consultation.
Assalamualaikum, ma'am.
Waalaikumsalam, sir. Can I help you?
I want to meet the midwife if there is a midwife.
Midwife is there today. What need do you want to meet with a midwife?
My wife went to do the consultation because soon they will give birth.
Congratulations. I call the midwife for a moment.
The assistant midwife informs the midwife that there is a patient.
Mom, a patient come to do a consultation. Mom.
Please come in.
The assistant midwife calls the patient.
Mom, sir, please come in.
Good morning, ma'am.
Morning too. Please sit down, ma'am and sir.
Thanks, ma'am.
Introducing me, the Nagita midwife. This morning. What are the complaints, ma'am, for today?
I want to do a consultation about when I want to give birth, ma'am.
So, what do you want to ask?
What should be prepared during labor, ma'am?
So, what must be prepared is the ma'am cloth as much 2 or 3 pieces, sir. Then the ma'am underwear 2 or 3 white cloth, and the ma'am toiletries. While for the baby, what you have to bring is baby cloth consisting of 6 cloth, baby octopus, and the baby toiletries.
The clothes used by ma'am, okay?
Probably clothes with button on the front to make it easy for the ma'am to breastfeed later, and clothes that are loose and not thin if possible.
Then why 4 more baby clothes diapers, ma'am?
Because in case the baby defecation and poop.
Both my husband and I will prepare what is needed.
If the baby clothes are just broke, do they need to wash it?
Necessary because to keep the clothes that the baby will wear clean.
Then what size will feel if I want to give birth?
If the ma'am feels a strong contraction from the navel to the waist, as well as strong regular contraction and mucus mixed with blood are signs of labor. But if the ma'am feel a contraction but only in the lower abdomen and irregular contraction are followed in the absence of mucus mixed with blood, it is not a contraction of the or to give birth.
Then, what activity should my wife do to simplify and speed up the union?
All you have to do is do relaxation technique so that the mom is relaxed and calm. Then doing pregnancy exercise and doing activities such as walking for 13 minutes with your feet slight rise 19 degrees and doing mopping in a squatting position.
Then whether the labor that my wife will go to through is long enough.
Gilbert, there are 4 times that the mom will go through because the pregnant woman is only the first child and has never had a miscarriage or childbirth. So, at stage 1, she will be admitted for 30 hours, and when one waits for the opening to complete the opening, namely 10 centimeter opening. Then the two stage is the process of expelling the baby, which occurs within 1.5 minutes to an hours. Then, after expelling the baby, there is stage 3, namely the process of removing the placenta, which occurs 15 minutes to 13 minutes. Then, the last stage 4 is when monitoring the mom will monitoring awareness, blood pressure, pulse temperature, blood discharge, and fundus uterine high to ensure the mom condition is fine, and the baby will also be assisted in awareness and response.
Are there any complication that I will have at this time and when I need to give birth?
The complication at this time or during is the third trimester of pregnancy if the mom feel severe dizziness, blurred vision, excessive nausea, vomiting, heartburn, premature discharge of the amnion fluid, green amnion, fluid and maternal bleeding can come right here, ma'am. But during childbirth, complication which mainly occurs is a long progression of labor, dry amniotic fluid, presentation of breast and transverse location, a large baby causing shoulder dystocia or shoulder obstruction. The baby has asphyxia, an abnormality in the baby. The placenta does not come out in 13 minutes. The uterus is not contraction, blending. It's a possibility that could happen, ma'am. But you just need to pray and routine checkups, ma'am. I see this from her books. Ma'am is pretty good, ma'am. Well, check the situation first, ma'am.
Okay, ma'am.
assistant midwife can help me to check on this, ma'am.
Okay, ma'am.
Check the head area that is checked for black or corn yellow hair, and then check whether there is a oil skin after, whether there is a wound on the head hair or not. What we examine in the A. If the conjunctiva is white or yellow in color, then we check the test for pink or pale color and see if the patient has strabismus or not. Then in the face area, we can is there clausma gravidarum and or not, then is there swelling in the face area. Then in the nasal area that we check is the symmetry of the nose or not. Always observe whether there is discharge or not, and the nasal hygiene. Then in the part of the mouth that we check is the hygiene of the mouth. Does the mouth have caries or not? Then the tongue is dirty or not, and whether the patient lips are kept or not. We go to the neck area, which we examine are the lymph nodes of the thyroid and parathyroid, whether they have swelling or not. Go to the breast area that we examine is the symmetrical shape of the breast, whether the nipple protrudes or not, and there is a change in the color of the areola or not, as well as the presence of tenders or not. Go move on the abdominal. The part of the abdominal that area checked are whether there is a linea or striae in the abdominal area and discoloration in the abdominal area. After that, measure the height of the fundus uteri in the mother, which is determined from the top of the fundus to the symphysis. During the uterine fundal height is the Leopold examination. The Leopold examination is an examination that determines the location of the fetus, which Leopold 1 to determine the top part of the fetus, whether the buttocks or the head. Then the Leopold 2 to determine the right or left part of the fetus, can be the back or finger. Then Leopold 3 to determine the lowest part of the fetus, can be the head or buttocks. Leopold 4 to determine how big the fetus has entered the pelvis. And after doing the Leopold, we do a fetal heart rate check. Then we check our vaginal area. We are clean or not. Then we will see if there is a discharge that smells and colors. Check the leg of the mem for swelling or not and varices veins or not. For the non-advised, the mother to tilt to the left first before getting up. Check the mother patella reflex. Mem is positive or not.
The result is the mother's blood pressure is 110/80 mmHg. The pulse is 80 times per minute. There are no facial swelling of the feet and hands. TFU 28 cm. Head presentation. Only a little part of the fetus has entered, and the fetal heart rate is 145 times per minute.
Ma'am, as my assistant told me, the condition of the ma'am is quite normal. Ma'am, you only need to the sport, relax and pray for the delivery of the labor, ma'am.
Alhamdulillah. Well, I will follow the advice of the midwife.
Ma'am, I will give you vitamin tablets with blood and calcium for tablet. Take the blood once a day at night before going to bed, and for calcium once a day in the morning after breakfast. And this blood added tablet has side effects, namely constipation and difficult defecation, ma'am. Can overcome it by drinking lots of water and eating fruit and vegetables that have fiber, ma'am.
Okay, ma'am.
If anyone wants to be asked again,
Okay, ma'am.
Assalamualaikum.
Waalaikumsalam, ma'am and sir. Thank you.